Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's health policy podcast. I'm here today with AMGA's all-star crew. Sharon, our communications chief, said that we have to keep our banter to less than 4 minutes, and I say we double down and do 8.
So we have to act like we don't like each other.
Wow. Well, we act. I was not aware.
I like you guys. I like working with you all.
Oh, you're young. Okay.
You'll get the
I'm
cynicism.
still full of hope. I'm here.
We'll fix that.
Perfect.
We're lobbyists, so well, let's do invite and let us name ourselves. Why don't we start at the far left, which actually makes sense politically?
I'm a moderate.
No, you're not.
Country Club Republican.
You were.
Jamie Miller, Ambassador of Goodwill here at AMGA. And I lobby all sides.
There you go.
Alicia Sawyer, Government Relations Assistant.
Hi, I'm Daryl Drevna, Senior Director of Regulatory Affairs.
Very good. And Lauren Latney is not here. She's at another AMGA meeting, which makes Daryl very happy because no competition between the divas.
Yep.
And it also means that Jamie can carry a lot of the legislative load, which is what this podcast is about today.
And talk about my feelings.
And you probably will.
Should we bring up Ave Maria? His favorite song? Call back to the first season?
Cry. Come on. Jeez.
We'll talk about that at your eval. But anyway, so welcome and thank you. And we actually thought about this question last week, so I'll pose it right now. What do we like, pancakes or waffles?
I feel like I'm the one with the strongest opinion about this and brought up the conversation, so I'll go first. I'm a big waffle fan.
Yes, all right.
I like only blueberry pancakes, but waffles take the cake for me.
Any reason?
Waffles have a better texture. Pancakes, they're just...
She's right.
Yeah.
If you do your waffles correctly, there's a little bit of a bite and a little crisp to it, and the little squares hold the syrup in. So it's very orderly on the plate. I like that.
I like that too.
It's like a high school lunch plate. Okay.
Jamie?
For those of you who come to DC for Capitol Hill Day or any, please reach out to us. But there's a place called the Eastern Market that makes the best pancakes. They're blueberry buckwheat, and they are fluffy and delicious. And the staff can be rude to you, which I think is fun.
There is a long line for those pancakes.
Yeah.
I've had them.
They're not always rude,
I'm
but
not waiting in line
worth
for
it.
pancakes.
they
But,
scream
yeah.
your name and number, and you better get it, because if you don't, they're going to give it to somebody else. It's like, yeah.
High demand pancakes.
Yeah.
Sounds like the Eastern Market. And my guy, can you answer that question with authenticity?
I'm gonna go pancakes.
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 Easier to make.
It is.
Okay, well, it's not that much harder to make a waffle. You just need an iron, I guess. But it's the same process for making the batter. You just buy some Bisquick.
We love everybody here. This is Filibusters in Fine Print. So, all right, well done. Well, thank you for the answers. So today we're going to talk about a major piece of legislation which is being drafted as we speak that may actually keep the federal government open. Is that true?
Maybe.
Of course,
Maybe it'll
on the
pass.
other side of things, if the government did close, could we invade Greenland? So that's an interesting question.
I'm not come prepared for that.
Jamie is not prepared.
For that.
I told you. So, Jay, what's going on?
So currently, Congress is debating the continuing resolution, which funds the government. The House and Senate introduced legislation to fund the government, passed, I think it was September 30th, 2026. It is currently being debated on the House floor. When this comes out, hopefully it'll be in the Senate, and it needs to pass by January 30th. There's a lot of complicating factors that just came out. As you probably are aware, there is a lot of press attention around ICE and funding of ICE, and so a lot of Democrats have said they're going to potentially oppose this major legislative package, at least on the House floor. But what of interest to AMGA members is that we have a lot of extenders that we've talked about over the last couple of months, as around telehealth, hospital home, Medicare Gypsy, and Medicaid dish cut delay. So those are our folks will talk about that in a little bit. But here we go again, I guess, is we're hitting another cliff. and it's definitely going to be an interesting time in Congress. And which you need to pay attention to is there'll be a lot of other small policies that could affect AMJA members as well, and we'll brief you on those accordingly.
All right, sounds good. So things are moving forward, and we're sort of confident.
And we had a busy Christmas and January.
We did.
Yeah,
As we go into eval season, I guess you're going to say that over and over again.
I worked a lot.
Yeah, you worked a lot. Okay.
I tried so hard.
yes, you try hard. So what is in this bill, and how does it impact AMGA members?
I would say we'll talk about those flexibilities, telehealth, and other things. But before I get to that, I just want to mention that this healthcare cliff is complicated because you'll see when our colleagues talk about it, they're extending various programs at various times. So in the next 5 years, we're going to have 4 or 5 different cliffs and 4 or 5 different opportunities. But I think first we can kind of talk more about how our members are impacted by telehealth.
Yeah, so as Jamie mentioned, the extension of Medicare telehealth flexibilities would be until December 31st, 2027.
That's good.
Yeah, we're grateful
long, right?
that the extension is until 2027 instead of just 3 months or who knows, you know. But we're still going to continue pushing for a permanent extension. 2027 sounds like a long time now, but we're in 2026. 2027 is quick approaching, and we need to be able to plan for the future. And another thing that has been extended until 2030, which is great, is the hospital at home program, which is typically connected to telehealth flexibilities in a lot of the legislation we've supported. And so hospital at home will be until September 30th, 2030. And that allows for more stability for people to invest in the program. But again, 2030 is great, but it'll be quick approaching also.
You got the good ones, so you know.
All right, before you jump in.
Oh, okay.
Diva too.
Yeah.
I would like to note that 2030 is when my daughter graduates from high school. So that's a very important date for my high school graduation's daughter.
That's the real curve.
Yeah. Hospital home is important.
So we're going to plan Capitol Hill Day on her graduation date?
You can go ahead. I will not be there. But sorry, did I interrupt?
No. That's good to know. You have to plan those things out. I know my son's graduation is already on the calendar, and that's a date that's not going to move.
Year, right?
It's next year. Yeah.
Okay.
And then
27. So he's linked to telehealth, and Barclay's linked to
Hospital at home.
hospital home.
Okay, very good. Okay, we'll remember those dates.
Yeah. Okay. That's how we're gonna move forward with this. So, one of the dates that isn't as far out is for the GYPSY floor, or the geographic work index floor. That's only for a year in this proposed bill. So it go until December 31 of 2026. And this is the provision that, keeps physician payments above a national floor. So really it prevents cuts to lower cost areas from falling below a national baseline.
That's great.
Yeah.
And I think Medicaid DISH is also.
Yeah, it's also Medicaid DISH is also part of this, and that extends until October 1, 2027. And this is, like we could spend a whole lot of time talking about the DISH formula, and I would recommend that we do in one of these podcasts.
I'm sure we
That sounds like a regulatory podcast.
I think so. So I'll have to get that.
We have an
But
abacus
essentially,
when you do it.
sorry, say again.
We have an abacus, or what's
Oh yeah, the little beads
That's
to
when
move
we
it
go
around.
visual. That's when we go visual.
Oh yeah, that's when the YouTube channel pops up.
have
We're working on that.
Get ready, audience. Get ready.
When we go,
It's
take
gonna happen.
this thing off audio only, and into Technicolor or something like that. But anyway, the number of uninsured folks are expected to increase because of the cuts in Medicaid that we've been talking about. So it's really important that, particularly safety net hospitals have the resources they need to care for this population, and the Medicaid DISH formula is part of that. So it's a good thing they're extending this prevention of a cut that the formula otherwise would impose, through the end of October 1, 2027.
That's good.
Yeah.
That's very beneficial to AMJ members. So this so far so good on this package. Jamie, there's some value pieces in here also, isn't there?
There's a bonus provision, literally. So it wasn't in the health extenders in the shutdown bill in November, but the Advanced Alternate Payment Program that was created under MACRA had these bonus incentives for qualifying practitioners that met the threshold requirement, and so they get a bonus 2 years after their performance year, and that expired last year. But in this bill, Congress wrote a 3.1% bonus for providers that provide care in 2026, and they get the payment in 2028. And that's great for our members who are doing APMs instead of doing the MIPS, because it allows them to get beyond the payment differential and the conversion factor that they're going to get. This is going to allow them to get a potential bonus to help pay them back for a lot of the expenses they're doing. And also, it keeps the threshold for participation at 50% instead of 75%, which is a provision that AMGA has been working on, the bonus and the threshold for a very long time.
All right, so good deal. So we have telehealth, hospital home extended, Medicaid dish cuts prevented. We have an APM bonus sort of reinvigorated for 28. This is a good bill for us so far. What's not in the bill?
Well, over Christmas and January, the House and Senate were discussing the enhanced premium tax credit extension. As you probably recall reading on our e-news, the House actually had a few Republican folks support an extension of the enhanced premium tax credit, but the Senate has still yet to act, and a lot of negotiations have broke down on that. So right now, the enhanced premium tax credit has expired. There is not really talk of extending it as of yet. That's going to result in 1.7 million enrollees not getting access to subsidized coverage. And so that's going to, as Daryl mentioned with the dish, that's going to result in even more uninsured people. And also with the increased price of premiums, because of all premiums in general going up, there's going to be a lot of uproar in Congress because they're hearing from their voters about the increased cost of care. So yeah, that's definitely a thing that's missing from this program, and there just could not be any compromise on that.
Well, let's hope they keep talking.
And we'll keep being involved in telling the consequences of their actions.
Good. It's also election year, so
yeah,
that gets magnified in 26. So, Daryl, question for you. We have all these cliffs. We have a 3-month cliff, a year cliff, a 2-year cliff. How does this back and forth, stop and start impact AMGA members? Because it seems like operation that makes it difficult.
Absolutely. It's, CMS has to, follow the letter of the law. And if telehealth is authorized through a certain date, they're going to stop payment, the day it expires, or, they're going to implement a dish cut, or whatever the law requires of them to do, they're going to do. And of course, that trickles down to our members who have to figure out, how do we design a care delivery model around what is authorized, what's going to get reimbursed, and all that. You might say all this, waffling back and forth.
Oh, wow.
Yeah.
Between audio only and waffling, you were on fire.
Yeah, no. So it creates a huge problem for our membership. We've heard from some members who we're just not going to do telehealth anymore. Some of them are continuing to do it with the understanding that we might not get reimbursed past a certain date. So, we hear over and over, this creates this confused, uncertain environment that makes it really difficult for members to plan and really execute on what they want to do to best provide care for their patients. And this constant back and forth or changing makes it incredibly difficult to do so.
Yeah, you wonder what other business cannot plan beyond 90 days sometimes. I mean, most businesses plan 5 years out, and CFOs need that time to invest in whatever infrastructure they need to be successful. Healthcare is the only business that is in a much different way.
It's almost like we want you to drive from point A to point B, but we're going to set up all these roadblocks, and then we're going to change directions on you, and then we're going to yell at you because you were late.
And Daryl, I think it's strange when conversion factor in the Medicare physician fee schedule, it goes final in November, and then Congress comes in December and fixes it. So then CMS has to go back and use time and money and resources to change everything.
It's such a waste. Yeah. It really is. We're focusing on these short-term fixes that really don't solve the underlying issue in healthcare. And it's just patch after patch after patch, and then we wonder why the system costs what it does, or patients aren't getting the care they need. So it just creates problems.
So generally speaking, our members need a predictable and stable financial platform.
Absolutely.
Right? Okay.
Yep, absolutely.
And I think that'll be one of our lobbying, regulatory, and legislative focuses for the next, year and 2 years.
Yeah, I think so.
Really important. Okay, great. Well, speaking of lobbying, so Alicia, what has AMGA done between the last shutdown and this current debate? And how are we active and how are we helping the members?
So since fall to now, we've been meeting with everybody we can, everyone that will listen to us. I think a big theme is that no one's talking to each other. That's something we say a lot, is we don't talk anymore. Both sides don't talk to each other, but we talk to both sides, and we kind of act as like a in-between almost. And so we've been pushing these issues and making sure that provider and patient voices are heard and represented at the table, and relaying the experiences of AMGA members when telehealth and hospital at home extenders expired, and how much patients struggled not being able to receive care that they had come to expect, and in ways that they had come to expect. And we have been trying to doing our best to advocate and make sure that it's heard by everyone who is willing to listen, and even those who aren't. And so some other things we've been working on is running a grassroots campaign that's currently ongoing, and that is supporting the January 30th expiring extenders as we approach that cliff. A lot of those extenders are represented in the current package that we just discussed. And then we're also preparing for Capitol Hill Day, when we'll have our members come in person to advocate with their members of Congress directly. You know, this is more than just sending emails. This is the next step after that. You know, you get your introduction in with maybe a grassroots campaign, and then you're there and you're at the table yourself. And then we're also working on our district advocacy program. We've been connecting members virtually with AMGA members with their member of Congress. And so if you're interested in getting involved in any of these programs, just contact us. All of our emails are available on the AMGA website, on the Filibusters in Fine Print podcast webpage. You can find us all listed there.
Outstanding. We talk about this all the time. The AMGA lobby staff, I think, is really, really good, very strong, very respected. We are even better when we partner with the AMGA members. And so we talk about this constantly, the need for you all, the listeners, AMGA members, to work with us, because going together makes a real difference. So we hope that you all engage with us in 26 and 27. Those will be our 2 big years. And thank you for all your efforts on everyone's behalf. So before we wrap up, anything else that anyone wants to add?
I just want to reiterate what Chet said about it being an election year. There's going to be a lot of attention to healthcare policy because of these extenders expiring, but also there's going to be a lot of things happening in the healthcare market you all already know, with telehealth and others. So just, be vigilant, and, please contact us. We're happy to get you involved. And like I said, there's going to be multiple bites of the apple to do healthcare policy this year and the years to come.
I have a question. I was talking to Lauren about this, and we're talking about how some of these extenders are further out, right? The deadlines aren't as tight as they used to be. And we're thinking, is this Congress trying to reassert itself a little bit? We've had so much power shift to the executive side of the ledger. Is this Congress trying to put its stake in the ground and say, hey, we're important too? Or is this just, we want to clear the decks, not deal with this?
You can make that argument. Another argument is some things that were extended longer don't cost as much money.
Okay.
So that might be why. I think with the APM provision, it should have been 2 years, but it's only 1 year because it cost $1 billion. Telehealth is shorter, but hospital home is a 5-year, and according to the Congressional Budget Office, that scores less. But I agree there could be some other thing about they're asserting their authority, but the main reason for certain things lasting longer or shorter is because Congress does things by budget.
Always about the money.
Always about the money, yeah.
Absolutely. Well, I guess we can end on that one, right? Because that is a truism.
Yeah.
All right. And we'll thank you all for listening, and hope you all have a very good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.